If you are over 60 and you wake up every single morning feeling like you barely slept at all, I need you to stop and listen very carefully right now. Because what you are experiencing is not simply getting older, it is not normal. And if you keep brushing it off the way most people do, you could be missing a warning sign your body has been sending you for months, possibly even years. Most people assume morning exhaustion is just part of aging. They think, well, I'm in my 60s now, this is just how it is. But here is what is truly alarming. Research published in the Journal of Clinical Sleep Medicine found that persistent morning fatigue in adults over 60 is actually one of the most overlooked early warning signs of several serious, and in some cases, life-threatening conditions. And the vast majority of seniors experiencing it have never been properly evaluated. That means millions of older adults are waking up exhausted every single day, living at a fraction of their true energy capacity, while the underlying cause quietly gets worse. Today, we are going to cover exactly what your body is trying to tell you, which 5 specific conditions could be driving this kind of fatigue, and precisely what you can do about it starting this week. I am Dr. Sarah Mitchell, and this channel exists to give you the most current, evidence-based health information designed specifically for life after 60. If you have not subscribed yet, please do that now so you do not miss what is coming next week, because it connects directly to what we are discussing today. New content every week, all of it built around you. Now let's get into this because there are 5 reasons your body may be waking you up exhausted, and I want you to listen carefully as I go through each one. You may recognize yourself in more than one. The first and the most dangerous, the one that physicians miss most often, is sleep apnea. Sleep apnea is a condition where your airway partially or completely collapses during sleep, causing you to stop breathing, sometimes dozens of times per hour, sometimes hundreds. Each time it happens, your brain jolts you out of deep, restorative sleep to restart your breathing. You usually do not remember these episodes. You do not consciously wake up. But your body is working frantically through the night, and by morning you feel like you never slept at all. Here is what makes this so alarming. A 2021 study published in JAMA Neurology followed over 2,800 adults between the ages of 60 and 80 and found that untreated sleep apnea was associated with a 300% increased risk of stroke and significantly elevated risk of dementia and heart failure over 10 years. 300%. That is not a minor statistical footnote. And the most troubling part is that most people with sleep apnea have absolutely no idea they have it. If you sleep alone, there is often nobody to tell you that you are snoring or gasping in the night. You just wake up wiped out every morning and assume that is just how aging works. Here is a quick self-check. Do you wake up with a dry mouth? Do you have a mild headache in the morning? Do you fall asleep watching television or reading within just a few minutes of sitting down? Do you feel foggy-headed or irritable well before noon? If 2 or more of those describe your daily experience, sleep apnea must be ruled out. I want to tell you about Frank, who was 71 years old when his daughter essentially forced him to come in and see me. Frank had been waking up exhausted for at least 5 years. He figured he just slept lightly as he got older, because he figured everyone must. He snored, but at his age, what could you do? His blood pressure had crept up over the years. He had gained some weight gradually, and his cardiologist was keeping an eye on a mild arrhythmia. When I ordered a sleep study, Frank's results showed that he was stopping breathing 82 times per hour. More than once every single minute. His blood oxygen was dropping to dangerous levels while his wife slept next to him completely unaware. Within 6 weeks of starting CPAP therapy, Frank's morning energy transformed dramatically. His blood pressure came down enough that his doctor actually reduced his medication. His arrhythmia episodes decreased significantly. 5 years of exhaustion, and the answer had been there all along. But sleep apnea is not the only culprit. And this next one surprises people. The second major cause of morning fatigue in seniors is thyroid dysfunction, specifically an underactive thyroid, which physicians call hypothyroidism. Your thyroid gland sits at the base of your throat and produces hormones that regulate your metabolism, your energy production, your heart rate, even your internal body temperature. When the thyroid slows down, and it does slow down with age more than most people realize, every system in your body slows with it. Studies show that subclinical hypothyroidism, meaning thyroid function that is declining but has not yet crossed the traditional diagnostic threshold, affects between 10 and 15% of women over 60 and approximately 6% of men. And here is what is deeply frustrating. Many of these people have thyroid levels that technically fall within the standard reference range, so their doctor tells them their thyroid is fine. But those levels are at the very bottom of that range, and for their specific body, that is simply not enough. The symptoms of an underperforming thyroid are nearly identical to what we casually call feeling old. Fatigue, feeling cold when others around you are comfortable. Weight gain without eating more. Brain fog, a kind of morning exhaustion that more sleep does not fix. This is exactly why thyroid dysfunction in seniors goes unaddressed for years. Comment below right now and tell me this. Have you ever had a thyroid test done? And if so, were you just told your levels were normal without being given the actual numbers? I would genuinely like to know how many of you are in that situation. The third cause is one that goes unrecognized constantly, and it has a particularly insidious pattern in people over 60. Vitamin B12 deficiency. Vitamin B12 is essential for your nervous system, for the production of red blood cells, for DNA synthesis, and for energy metabolism at the cellular level. Your body cannot manufacture B12 on its own. It must come from food or supplementation. And here is the specific problem for seniors. After around age 60, the stomach naturally produces less of a protein called intrinsic factor, which is what allows your digestive system to absorb B12 from the food you eat. You could be eating meat, eggs, and dairy every single day and still become severely deficient, simply because absorption has broken down. A study published in the American Journal of Clinical Nutrition found that B12 deficiency affects between 10 and 30% of adults over 50. That range is staggering, and the way it manifests is not just tired. It is a fatigue that feels like it is in your bones. You may also notice tingling or numbness in your hands or feet, increasing forgetfulness, difficulty concentrating, or a persistent low mood. Because B12 is absolutely critical for neurological function, low levels do not just drain energy. Left untreated, they can cause real, lasting neurological damage. Wait until you hear about the fourth cause, because this one is affecting nearly 40% of seniors, and the majority do not know it. Blood sugar dysregulation, specifically insulin resistance and undiagnosed prediabetes, is silently destroying the sleep quality of tens of millions of older adults right now. When your cells become resistant to insulin, your blood sugar fluctuates erratically throughout the day and through the night. This dysregulation, even well before it reaches a full type 2 diabetes diagnosis, disrupts what researchers call sleep architecture, meaning the natural progression through sleep stages that makes sleep genuinely restorative. A 2022 study in the journal Diabetes Care found that adults with undiagnosed prediabetes reported dramatically higher rates of non-restorative sleep compared to adults with normal blood sugar regulation. What this looks like day to day is waking up feeling unrefreshed even after 8 or 9 hours in bed, waking in the middle of the night feeling warm or restless without any clear reason, feeling mentally foggy or slightly shaky before breakfast, craving carbohydrates or something sweet first thing in the morning. These are not random inconveniences. They are your metabolism telling you something is wrong. The fifth cause is one that virtually nobody discusses in the context of sleep: chronic, low-grade inflammation. As we age, our bodies tend to produce higher baseline levels of inflammatory proteins called cytokines. This state, referred to in the medical literature as inflammaging, disrupts melatonin production, interferes with the cortisol rhythm that governs your natural sleep-wake cycle, and essentially tells your brain that your body is under some kind of threat. That signal keeps your nervous system in a state of low-level alert throughout the night, preventing truly deep, restorative sleep. Research from the National Institute on Aging has shown that elevated levels of a specific inflammatory marker called C-reactive protein, or CRP, are strongly associated with non-restorative sleep in older adults. And the conditions that drive inflammation, including excess body weight, chronic stress, high sugar intake, and untreated sleep apnea, create a reinforcing cycle. Poor sleep worsens inflammation. Inflammation worsens sleep. Both keep getting worse until someone interrupts the pattern. I want to tell you about Dorothy, who was 67 years old and sleeping a full 9 hours every night, yet waking up exhausted without fail. 2 previous doctors had told her she needed to exercise more and stress less. When we ran a comprehensive blood panel, Dorothy's C-reactive protein was significantly elevated, her B12 was critically low, and her thyroid levels, while technically in the normal reference range, were sitting at the absolute bottom of it. Over 12 weeks, we addressed all 3 systematically. By week 8, Dorothy told me she was waking up rested for the first time in what felt like a decade. Here is exactly what I want you to do. Not vague advice, specific steps. First, schedule a comprehensive blood panel and ask specifically for these tests by name. Ask for a full thyroid panel, including TSH, free T3, and free T4. Not just TSH alone, because TSH in isolation misses a great deal. Ask for vitamin B12 levels. Ask for fasting glucose and hemoglobin A1C to evaluate blood sugar regulation. And ask for a high-sensitivity C-reactive protein test, written on the lab form as HSCRP. If your doctor pushes back, ask respectfully but firmly. You have every right to this information. Second, if you snore regularly, if anyone has ever mentioned you stop breathing in sleep, or if you recognized yourself in 2 or more of those sleep apnea symptoms, ask your physician for a sleep study referral. Modern home sleep tests are straightforward and non-invasive. There is no reason to go without this information. Third, if your B12 result comes back below 400 picograms per milliliter, even if you are told it is technically within the normal range, ask specifically about supplementation. For seniors, sublingual B12 is strongly preferred because it absorbs directly through the tissue under the tongue, bypassing the digestive absorption problem entirely. A typical maintenance dose is 1,000 micrograms daily, but your doctor should confirm the right amount based on your specific lab results. Do not guess at this. Fourth, if elevated inflammation appears to be a factor for you, the most evidence-supported dietary step is reducing ultra-processed foods and refined sugars, while increasing omega-3 fatty acids. A high-quality fish oil with at least 1 gram of combined EPA and DHA per serving has been shown in multiple trials to reduce CRP levels meaningfully over 8 to 12 weeks. Look specifically for a brand labeled molecularly distilled and third-party tested for purity. Products with this certification are available at most pharmacies and online retailers. Please do not begin any new supplement protocol without speaking to your physician first, particularly if you take blood thinners, diabetes medications, or any thyroid medication, because interactions are possible and your doctor needs to know what you are taking. Fifth, give any intervention a minimum of 8 to 12 weeks before you evaluate whether it is working. The body does not change in 2 weeks. Patience here is not optional. It is just biology. Here is the single most important thing to carry away from everything we covered today. Waking up exhausted every morning after 60 is not something you simply have to live with. It is not inevitable. It is your body communicating clearly that something is interfering with your restoration overnight. Whether that something turns out to be sleep apnea, thyroid dysfunction, B12 deficiency, blood sugar irregularity, or systemic inflammation, every single one has a clear path to diagnosis and meaningful treatment. You have significantly more energy available to you than you are currently experiencing. The only question is whether you are willing to take the steps to find out what is blocking it. I want to hear from you in the comments right now. Tell me which of those 5 causes resonated most strongly with your experience. Or, if you have already been diagnosed with one of these conditions, share how long it took before anyone figured it out. Your experience could be the thing that helps someone else finally recognize what is happening to them. If this video gave you something useful, please subscribe. Every week, I bring you health information built specifically for life after 60. Research and practical guidance your physician often does not have the time to walk you through in a brief appointment. You deserve to understand your own body at this level. Next week, we are going to talk about something that affects nearly every adult over 60, and almost nobody is addressing correctly. The specific nutrient combination that research now shows is essential for maintaining muscle strength after 60, and why most seniors are getting the timing completely wrong. That timing mistake alone could be costing you years of physical independence. You will not want to miss it. I am Dr. Sarah Mitchell. Take excellent care of yourselves, and I will see you next week.